I think there's a lot of layers that keep people locked in and keep them continuing to, for lack of a better word, poison their body over time. And you've touched on this, but I want to make sure we elaborate. There's different kinds of stressors on the body. You mentioned the hemlock that'll kill you right away versus some of these other plant toxins that are in fruits and vegetables that you get at the grocery store that are more of a chronic low exposure over a period of time, and people don't feel it right away. So they continue to hammer their body over a period of time and then get a chronic disease years down the line and not realize necessarily where that's coming from. And it just it appears just to sneak up on people. So there's a lot of different reasons why I think people are being duped by these plant toxins. And I think that's a big piece of it.
Yeah, and that's the thing. Slow poison is still poison. It can take time. It can take a long time. It can take years to build up, but it does. And in most people, it will cause just a general feeling of not feeling your best, not the best energy. Maybe you're difficult to get rid of that spare tire, or maintain your youthful body fat percentage. And for others, it'll be much more pronounced. They'll be much more sensitive to this exposure, and they'll get cystic acne, and they'll get hormonal interruptions, the PCOS, polycystic ovarian syndrome, which is a leading cause of infertility in the Western world, and or for female driven infertility anyway, and autoimmune issues, and heart disease, and diabetes, and even cancers are now being, well, they've actually been described as a mitochondrial disease as opposed to a genetic disease 100 years ago by Nobel Prize winner Otto Warburg, who did decades of work on cancer and the mitochondria, and wrote his seminal work in 1951 called The Origins of Cancer, where he shows that every cancer cell in every tumor has dysfunctional mitochondria, and they're damaged and they can't work properly. And this is the problem, because mitochondria are what stop your cell from dividing out of control. They're also what are involved in apoptosis, which is programmed cell death. So your body says, okay, well, the cell says, hey, something's wrong here. We got to shut this down. It's the mitochondria that action that. And so when the mitochondria aren't functional, there's no kill switch. And so that's a hallmark of cancer, is its unregulated cell growth and an inability to shut itself down, and that's all run by the mitochondria. And so, and people can read his work, read the work of Dr. Thomas Seyfried, who has over 150 published peer-reviewed papers and studies on the subject of cancer biology, and I've studied biology. He teaches cancer biology, and it really does appear that this is more mitochondrially driven. And you eat a lot of these things and damages your mitochondria, damages the function of your mitochondria. Just eating a lot of carbohydrates can cause a dysfunction and dysregulation of your mitochondria. Just having high insulin can prevent your body from going through. People in the sort of health and wellness sort of space, doctors and clinicians and whomever, talk about, maybe fasting for autophagy, letting your body sort of clear out these older cells that are maybe just not as functional. But you can also go through mitophagy, where you replace these older mitochondria. When your insulin is high, it's stopping all of that. And so you need to fast and get this stuff out of your system, or you just go on a ketogenic diet, which a carnivore diet is. I think it's the ultimate ketogenic diet, and it allows your body to sort of get back to normal workings. And within a couple of months, there are studies that show that just going on a ketogenic diet really benefits the health of your mitochondria. And so they increase the number of mitochondria, quadruple the number of mitochondria, and quadruple the efficacy. So it's 4 times the mitochondria, and they work 4 times as well. So that's a massive, massive, massive boost in your productivity and the function of your cells and your mitochondria in general. Even implicated in psychiatric disorders, like schizophrenia, major depression, bipolar, OCD, ADHD, even autism. These are now being argued that these are mitochondrial disorders. They've actually been argued for 20 years to be mitochondrial disorders. Now it's really getting a big push, especially from Professor Chris Palmer from Harvard. He's a professor of psychiatry there, who I've had on my podcast as well. And he wrote a book called Brain Energy, and he really argues this is a mitochondrial disease. And when you fix the metabolic health and the mitochondrial health, you can actually reverse schizophrenia. So he's actually clinically reversing schizophrenia, major depression, anxiety, crippling anxiety, and OCD, bipolar. You can even really augment and help someone with autism, even as an adult. If you approach it as a child, though, they still have room to develop, and they can actually undo some of the damage that has been caused by this misdevelopment. And but it helps pretty much everyone. So there are just a number of different benefits that eating this way can give you that most people are just completely unaware of, and it just builds up over time. And we have these things described as diseases, and we try to treat diseases, and we don't have very good treatments for them. Psychiatric diseases in particular, only about 10% of people respond really well to medications, and then sort of half the rest of them are middling sort of response. And for many people, it really doesn't work at all. You only get the side effects, you don't get good effects. And that can be the case for a lot of things. And so we're sort of in a disease management system now, where we're just sort of mitigating the symptoms of different diseases. We're not addressing the root cause of diseases. And a lot of these have to do with our mitochondria and our metabolic health. And that is in large part being damaged by the food we're eating. We're not eating what we're biologically designed to eat. All animals need to eat a very specific diet, what they are biologically designed to eat. This is why you have signs at the zoo that say, don't feed the animals. It makes them very sick. Don't feed the animals the thing that you're eating right now that's making you sick. It makes them sick, so don't eat it. You should also say, just don't eat it. Don't eat what you're eating, and don't feed it to the animals as well. Any zookeeper will tell you, if you feed an animal something that it doesn't eat in the wild, something that it didn't evolve on, it gets very sick. But what does it get sick with? It gets obesity, heart disease, liver disease, diabetes, cancer, autoimmune issues, and arthritis and things like that. Dogs and cats, known carnivores, and yet we give them grain and plant-based kibble. And veterinarians are now saying that there's this large rise in so-called human diseases in domestic animals. Okay, well, these are non-communicable diseases, right? So you can't pass arthritis on to a dog. I can't pass diabetes on to my cat. And so, or cancer for that matter. So something's rising. Something's causing this to rise. And as we have increased the prevalence of feeding them things that they don't normally eat, they're not biologically designed to eat, you're seeing these diseases go up. And zookeepers, well, I've actually spoken to one, I've asked him, do you guys ever give, kibble or grain or this, that, and the other? And he's like, are you crazy? They'll get human diseases if you give them that crap. And so, and use that word, human diseases, right? So these aren't human diseases. These aren't even diseases at all. These are chronic exposure to something that we are not biologically designed to eat, and they're not biologically designed to eat. Dogs and cats are not biologically designed to eat. Food is very specific in the animal kingdom. You eat very, very, in all life in general, is very specific. Animals that eat plants for their whole life, they don't eat any random plant. They eat extremely specific plants. There are 340,000 plants in the world. Koalas eat one. Pandas eat one. Cows, horses, grazing animals, they eat grass. That's it. And they eat different kinds of grass. They eat specific grasses or they get very sick. The leaves that a giraffe eats are different from the leaves that a gorilla eats. Those are different from the leaves that a deer eats, and so on. And you mix those leaves around, they all get sick or die. So they have to eat very specific things. We are the only animals on Earth that eat such a wide variety of foods. No animal eats the variety of plants that we do. And I think that that's causing and driving most of the modern non-communicable chronic diseases that we face these days.
You made it really clear there that at least part of the root of all these different diseases is the mitochondria and metabolic health. Do we know what might be even further upstream than metabolic health and the mitochondria, or something else that's in that same realm that's being affected by this diet that is impacting in such a positive way so many different conditions?
Well, metabolic health and the mitochondria are certainly a big part of that. And we're finding that many of these chronic diseases are, exactly that, from dysfunction and dysregulation of the mitochondria to different degrees and in different ways. And the genetically susceptible and the right, perfect storm sort of conditions, you're going to get a certain disease. But it's not just the mitochondria, because this can disrupt so many different workings in your body. And even that the idea that autoimmune conditions are a response, an immune driven reaction to something that's getting into your body. Maybe you get there's a lot of these different lectins, which are toxins in plants, that can bind to our to carbohydrates. You have this sort of glycocalyx that is sort of this or glycobiome that are a bunch of sort of carbohydrate proteins and carbohydrates that sort of stick out on the surface of cells, and some of these things have carbohydrates, and this can bind to those carbohydrates, damage them, disrupt them, damage the cells, damage the tight junctions in between the cells in your intestinal lining. And so now it's actually this open airway. So instead of these cells blocking off things from coming in, now there's actually like an open gate, and things can sort of seep in and get into your body and your bloodstream that are not supposed to be there, and your body can react to this and have an immune response, have an inflammatory reaction. So people are saying, oh, we want anti-inflammatories, but everyone's inflamed, everyone's having all these problems. Well, part of that is because we're letting things into our body that we don't want in our body, and our immune system responds to this. Our cytokines, rise up and try to fight this and contain this stuff from, disrupting our normal workings. And so we can make antibodies to this, and those antibodies in the genetically susceptible can go and attack other things. As far as I know, I don't have the genes for Crohn's disease. I've never experienced that anyway. And so, me eating these sorts of things aren't going to give me that, but in the genetically susceptible, they can get that. Or someone with Huntington's, they have the gene for Huntington's. By and large, I understood this to be very high penetrance, meaning that if you had the gene, that you were very likely to get the disease. But it seems for some reason people go on a carnivore diet and they're actually helping their symptoms of this. I think that's amazing. This is anecdotal. Obviously, this is just people's experiences, but that's really all that matters to that person. Does it work or not? Is it helping me or not? Is my brain degenerating, my body degenerating, and am I going to die soon? And in these cases, no, they aren't, and they're getting better. So that's very important. So there's a number of different things that this can disrupt in your body. Autism, for example, there are going to be issues with malnutrition and malabsorption and other things that can disrupt our body as well. So in autism, there was research out of University or Texas A&M in America, and they found that a type of autism could be caused by a carnitine deficiency. Most people make carnitine. We consider this a non-essential amino acid, meaning that we make it. We don't have to have it from our diet. But there are plenty of studies showing that even people that make carnitine, eating more carnitine actually is beneficial in a number of different ways. But either way, only about 70% of people actually make enough carnitine that they don't need it in their diet. And some people don't make any carnitine at all. Right. So that's actually a big proportion. 30% need carnitine in some form, in some amount in their diet, be it a large amount or a small amount. Well, carnitine, as the Latin root, carne, carnivore, carnitine, this comes from meat, right? And so it doesn't exist in plants. It doesn't exist in fungi. And so you have to get it from meat. Now, it exists in most animal products, most dairy, most meat, but a lot of it you get in red meat. And so what's the first thing that vegetarians do? They drop red meat because that's the worst, right? Well, actually, it's the best. And then, vegans who don't eat any plant or animal products at all, they're not getting any exposure to carnitine. So if your kid has a deficiency in making carnitine, even to a small extent, and you're not eating any carnitine, any meat or animal products, they might exhibit this misdevelopment of their neurons. It actually, carnitine is very important for your mitochondria as well. And so, but it's an integral for the development of the neurons and the mitochondria in the neurons that are then have this knock-on effect of not developing your neurons properly and specific neurons. And so then you can develop or have a misdevelopment of your brain cells. And we would call that autism. And so, and vegetarians, maybe their kid don't make any carnitine at all, and if they're not eating like the red meat, maybe they really do need the red meat. So this is a part of why autism rates are going up, because historically most people, if you could afford it, would eat meat, and they'd eat meat whenever they could if they could afford it, because they understood that this was very important and healthy. And so we didn't really see it as often. But now the rise in vegetarianism, veganism, and the vilification of meat over the past 40, 50 years plus has put us into a state where more and more people are trying these plant-only diets, and then the genetically susceptible, they're getting this malnutrition, malnutrition in general, and they're getting problems thereof. So I think that the majority of these metabolic issues, or call them chronic diseases, these non-communicable diseases that we're treating as a mainstay of modern medicine, I don't think are diseases per se. I think they're toxicities and malnutrition, toxic buildup of a species inappropriate diet, and a lack of species specific nutrition, right? And so too many plants that we haven't evolved to break down appropriately, and we can't get the requisite nutrients from, and not enough meat, which we get all of our bioavailable micro and macronutrients from. And I'm not saying that there are no nutrients in plants. Of course there are, but there is not a complete complement of nutrients in plants. And there are many micronutrients that we aren't even aware of that are in meat that likely won't exist in plants. But there's nothing that we have to have in plants that we cannot get from meat. But there are a number of things that we have to have that are in meat that we cannot get from plants. So you have to have meat. If you want to eat plants as well, that's up to you, but you don't have to. And there's a lot of reasons why you don't want to. One of them is just because they have these toxins, they have these different enzymes and proteins and things like that can cause harm, but also because they have digestive disruptors. They have protease inhibitors like in wheat and soy. They get in the way of your body breaking down protein properly and absorbing it effectively. So even if you're eating that with meat, you're eating a sandwich, with whole wheat bread or something like that, the protease inhibitors can actually block the breakdown and absorption of the very bioavailable protein that's in meat. And the fiber can actually act as a block as well, can actually interrupt and delay absorption, or actually prevent absorption of all these different nutrients. So, you can get nutrient deficiencies. There's quite a lot of calcium that's in spinach, but because of the high oxalate content in spinach, there's actually been studies done decades ago showing that when you eat a lot of spinach, or you give spinach to animals and things like that, and they're expecting their calcium to go up, they're saying, oh, this is a good source of calcium. Actually, the calcium goes down because the oxalates are actually binding calcium and going out. You get calcium oxalate stones. Is like something like 75% of kidney stones are calcium oxalate stones, around that anyway. And so we know this as doctors. You generally put people on low oxalate diets if they are getting chronic kidney stones, and this helps. And so, and there's other things as well. There's different ways that plants just bind up their nutrients in different ways, so they're not bioavailable. That's where that term comes from. Is this available to us? We eat this. It has calcium in it. It has iron in it. But are we getting anything from it? In a lot of plants, the answer is no, or at least to a diminished amount, because they're bound up in ways to try and stop animals from being able to get anything good out of it. There's a ton of niacin in corn, but if you don't chemically treat it and put it through a process called nixtamalization, which is what the Mesoamericans used to do before Europeans, found them, you cannot access the niacin. So there's actually the niacin deficiency is called pellagra, and there was a wave of pellagra that was killing millions of people around the world because it was generally very poor people, because corn was very cheap, it was easy to grow, and so they subsisted mostly on corn, and they were dying of niacin deficiencies. The irony being, there's a ton of niacin in corn; it's just not accessible by us, and that again goes into the biological nature and what we're biologically designed to eat. If we can't access these nutrients, we're clearly not biologically designed to eat them, right? If you have to put something through a chemical process, if you have to cook it to denature the lectins so that they don't kill you, which 5 kidney beans uncooked can put you in the hospital, can put an adult in the hospital, and the WHO has reported on that. If you have to put something through a chemical process to detoxify it or to unlock some of the nutrients, well, then that means that you don't have the physiology to detoxify it and get out those nutrients safely. So by definition, we are not designed to eat those sorts of things. And so, there's probably a lot of different reasons why these different chemicals, because there's a million of them, so there's a lot of different things, different ways that they disrupt our body and damage our health. And it's interesting to go into that and look at specifics. A lot of it has to do with mitochondria and damaging that, but whatever is happening, it's happening because we're eating something we're not designed to eat. And so if I think we just go to first principles and just eat what we're designed to eat, and all the best evidence shows that that's meat and fatty meat, and that's what our ancestors have been eating throughout the ice ages. There weren't plants available throughout the ice ages, generally, especially, where the Inuits and northern Canadians, where are the crops up on the ice floes? There are none. They're eating meat, and they traditionally eat meat. Now you can ship in different sorts of garbage food, but the traditional food was meat. They didn't have access to other things. And so that we know is something that we can get everything from. We can get everything we need in the proportion that we need it. And so I just stick to that. And and there are many things that work very subtly, right? That may not damage you until 60 years down the road. And oh gosh, who cares? I care. I want my body to work perfectly all the time. And so even subtle things that don't have that big of effect on me, I don't want them in my body. And other people can make their own decisions, of course, but that's just what I've chosen to do, and I feel great for it.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
No animal eats the variety of plants that we do, and I think that that's causing and driving most of the modern non-communicable chronic diseases that we face these days. It is the complete elimination diet.